Hello friends, let us now learn some important points about liver cyst. So liver cyst is actually a fluid filled space. It is a fluid filled space with some epithelial lining is called a cyst. Cyst is a fluid filled space with epithelial lining. So if this cyst is present in liver, then we call it as liver cyst. In the liver cyst, if you see, if this epithelium, actually it is an epithelium. So if this epithelium is actually columnar epithelium, if this epithelium is columnar epithelium, then we can say that this liver cyst is ductal in origin. Okay. Then the main cause of liver cyst is not known clearly. Similarly, the clinical features of the liver cyst and presentation of liver cyst is also unclear. But one thing which is clear is that liver cyst incidence increases with increase in age. The incidence of liver cyst increases with increase in age. That is, as the age increases, the number of liver cyst or the size of liver cyst increases. Then here if you see, it is a liver cyst. So in the cyst, it is actually number one, there are two important things. One, it is thin walled. Okay, it is a thin walled cyst, and in the cyst it is actually anechoic nature. Thin walled cyst is seen, and it also has an enhancement. That is, around it there is posterior acoustic enhancement is also seen. So there is an enhancement is also seen. So there is posterior acoustic enhancement is also seen in the USG. Similar, this is first appearance in the beginning. Now, as the patient, if there is either hemorrhage to the cyst, if the cyst develops hemorrhage, or if the cyst develops infection. So whenever there is hemorrhage and infection, in both these conditions, the patient will have pain and fever as clinical features. And in the cyst, we will see some changes seen in the cyst. In the cyst, we see that number one, there can be some internal echoes can be seen. Internal echoes are seen if there is hemorrhage because of the blood will create these echoes. Similarly, we can also see some septations are also seen. So if the patient has hemorrhage and infection, the cyst has internal echoes, septations, and also the cyst wall becomes thickened also. At the same time, there is thickened wall is also seen. And sometimes if you see, the whole cyst itself appears solid. That is, it is completely filled cyst is seen. So these are the changes which we see on uh, ultrasonography. So if you see the pictures, these are the different cysts. This is taken from Rumac ultrasound, diagnostic ultrasound. So in this is the patient in the A picture. In this patient, we see that the ultrasound has, if you see the wall of ultrasound is actually thin walled, and it is also filled with fluid, and the fluid has low level echogenicity. So there is low level echogenicity is seen in the cyst, and this low level echogenicity can mainly be due to the blood products. Blood products will result in this low level echogenicity. Then number two, these are the cysts. If you see, this is a cyst, and in this cyst we can see the internal septations are seen in the cyst. Then next, this is again a cyst. Here in this cyst, if you see, the echogenicity is more when compared to the diagram in A. So this is because of the clotted blood. That is organized clot. If an organized clot is present in the cyst, this will give this appearance. Presence of organized clot will give this appearance. Then this is again a CT image which shows homogeneous cyst. So this is showing a homogeneously appearing cyst in the liver. Then once you have diagnosed a liver cyst, what is the management? Liver cyst can be given first. First we can do intervention can be done. If the patient is symptomatic, then we will have to do some active intervention can be done, especially if the patient is symptomatic. Number two, if there is a cyst, we can aspirate the cyst with the help of the needle, and this aspiration can be done either ultrasound guided aspiration can be done. Next, and this aspirate will give some fluid, and this fluid is sent for diagnostic evaluation. By this we can know what is the cause of the cyst and what is actually responsible for causation of this cyst. Then we can also use USG, and under USG guidance we can do cyst ablation can be done with alcohol. Cyst ablation with alcohol can also be done under USG guidance for liver cyst. Okay. Then there is one more thing, that sometimes if you see in the liver, sometimes in the liver we might see a cyst which has thick septa instead of thin septa. Sometimes we can see a cyst with thick septa and also with some nodules. Okay, if we come across a cyst with thick septa and with nodules, in such cases, so in the liver, if there is a cyst with thickened septa and with nodules, then always suspect two disorders. One, we should suspect about metastasis, that is, we should suspect cystic metastasis, and we should also suspect biliary cystadenoma. So, we should suspect cystic metastasis and biliary cystadenoma. So, in both these conditions, either cystic metastasis or biliary cystadenoma, we recommend doing an CT, ACT. We can either do a CT or we can do a contrast enhanced ultrasound examination can be done. So if we see the picture, so this is a biliary cystadenoma where we see that there is nodules are seen, and we can also see presence of thickened septa, though they are not clearly visible, but nodules are seen. So this is the gross picture of biliary cystadenoma, and in this biliary cystadenoma we can see septations are seen, and we can also see nodules are also seen in this biliary cystadenoma. Always do a CT or contrast enhanced ultrasonography when you see this kind of lesion and ultrasonography. Thank you.